So we're here today to talk about our research journeys, the NIHR, and managing research alongside clinical demands. We're hoping to help people wanting to dip their toes into research feel more confident about being consciously incompetent, which is what we are. Next slide, please. So on the screen, you'll see some definitions that might be relevant during today's talk, and we just wanted to pop a trigger warning due to the mention of suicide in the presentation. Next slide, please. So we'll just introduce ourselves. My name's Grace, my pronouns are she, her, and I'm an advanced speech and language therapist at Leeds and Newcastle Gender Identity Services. So why did I get into research? I noticed the gap in the evidence when I was writing my dissertation and wanted to explore how to fill that. During my time working in NHS Wales, I was able to complete a PG cert funded by Health Education and Improvement Wales, which focused on advancing my clinical skills, but also gave me the opportunity to deliver a small-scale research project. The findings of this made me want to seek bigger changes to empower my patients. However, I completed the PG cert whilst working full-time without study leave, and this made me realise that I needed appropriate time to deliver any further research to ensure that I could give it the time it deserved. Then, when I moved into my gender role, I mentioned researcher interview as part of my career goals. My manager then connected me to the NIHR First Steps into Research scheme, which I just missed the deadline for. However, through further searching on the NIHR website, I found the Integrated Clinical Academic Internship, which is what we've just completed. Tricia?
Hi, my name's Tricia. My pronouns are she, her. I'm a senior mental health nurse working in the Crisis Resolution and Intensive Support Service at Leeds and York Partnership Foundation Trust. The service provides crisis support for working-aged adults across Leeds, and I work in the intensive support side, which offers home-based treatment to people with complex and/or acute mental health needs as an alternative to hospital admission. A few years ago, I moved teams to a different part of the city with a different socioeconomic profile and demographics. And while working in this environment, I noticed consistently high proportions of females between the ages of 40 to 60 on our caseload. And I started to wonder why this was, what was going on in this group of people. This is especially important as the highest suicide rates for females are in the age groups 45 to 55. This led to me looking at menopause and its symptoms and its effects on mental health and sparked an interest in research. And I just want to talk to you about my research journey now, my research pathway. So my pathway into research was somewhat haphazard and accidental. I was desperately trying to find out what research there was into menopause and mental health, barely any as it turns out, and I couldn't find anything significant. But I could see the effects in my patient population, and I wanted to find the latest evidence to inform best practice. I started making innovations in practice, such as producing a symptom checker for use with patients and giving presentations to clinical governance forums and different services in my trust to raise awareness. But my research journey really started when I reached out to local academics to see if any research was happening. The response I got from University of Leeds was amazing. I ended up with two fantastic mentors, Professor Linda McGowan, who has a background in midwifery and psychology, and Professor Liz Hughes, who has a background as a mental health nurse. Their response was, oh, this is a really interesting topic. Would you like a career in research? Which is not something I'd considered at all. Unlike medics, nurses and AHPs don't have research opportunities and expectations embedded in their roles, though this is slowly changing. I had no idea there were opportunities. It felt like research was a completely different role and I had no idea about it. Initially, I submitted an application for some pump priming funding to the Trust's Research and Development Department that was unsuccessful. My mentors then suggested applying for the internship, which I did, and here we are. Unis also want to promote opportunities, and the University of Leeds invited me to do a session on research and innovation in practice for third-year mental health nursing students earlier this year, which I'm pleased to say was really well received. And I recently co-delivered a research session to multidisciplinary preceptees within the Trust. So I don't have a clear future in research mapped out, but I have taken up lots of new opportunities, including a secondment as a clinical educator within the Trust. And I'll hand over to Grace to talk about her pathway.
So my research pathway has been a little bit more NIHR focused. So I mentioned the First Steps into Research scheme. Each locality in England will have its own version of that, as well as the ICAP, so the internship that we did. Each varies slightly, but they all have a similar focus. The pathway then becomes more standard when moving into the PCAF and onto the DCAF. I'm currently applying for pre-application funding, which can be used to apply for either the PCAF or the BCAF, and gives you up to a year to write an application and get some training. The reason the NIHR funding is so useful is because it provides study leave and potential backfill, which can make it highly desirable to managers. However, there are lots of other options available. One, for example, is the HARP, which is another fellowship scheme that focuses on minority research, or you can look at more traditional academic routes through findaphd.com. Things to consider are the formal qualifications, because sometimes the NIHR pathways don't necessarily provide you with formal qualifications if that's not the training you're looking for or can't justify that need for training. And you also need to think about your funding needs in terms of whole-time equivalent, so how much time you'd like to put aside, how much time you need to deliver the things that you're writing in your application. Similarly to Tricia, I explored my research goals by emailing different lecturers in my specialties and asking their thoughts on my plan, as well as speaking to other SLTs who are doing PCAF and DCAF through Twitter. As a note for students, there are summer internships that are run through the NIHR, and also universities might offer training opportunities to support lecturer publication. The other thing I just wanted to mention as a slight alternative within the NIHR is the Associate PI scheme. So that's the Principal Investigator scheme, where you'll work with a team to deliver a research project and collect data, where you will shadow and kind of be supported by a principal investigator who has experience. And that just allows that more hands-on opportunity and research. Next slide, please. So just talking about different tools that are available, there's quite a lot of them available to HPs, and they can be really useful in terms of establishing different routes into grant funding. For example, CAPA is a really useful network. So they're the Council of Allied Health Professionals in Research, and they provide email lists that you can sign up for, as well as opportunities for funding and some really useful training courses. One I recently went on focused on writing for publication, and it matched you up with someone else who's trying to write for publication, so you could have a bit of a support network there. The other one that's really useful is the RCSLT research framework. It's really helpful in terms of ideas on what to do with regards to training and development, especially when you're first starting out. And the HEE strategy is great for guidance in terms of justifying the need for research to management as well. Tricia, did you have anything to add there?
I do actually. So I've struggled to find specific resources for nurses. The NMC Code of Conduct says nurses need to understand research and apply the evidence, but there's nothing about being involved in creating it. So what I would suggest is that you contact your organisation's R&D department. Some trusts have really strong research profiles beyond just medics. They do offer any courses or training programs which you could do. They offer any courses or training programs which you could tap into or dip your toe into research. Reach out to academics in your field of area of interest. You'll need a supervisor if you apply for anything. So it's good to start having those conversations beforehand and build a network, which brings us into the next slide, which is things we'd wish we'd known sooner.
So the biggest thing for me is the opportunities that we had kind of come from just really dabbling our toes in as early career researchers. So I was recently funded by Arts and Minds Leeds for a clinical project with my gender outreach colleague. We were awarded £1,000 to deliver a wellbeing project with patients. I've delivered university talks. I recently won Research Hero in the Trust, and most importantly, I met Tricia. The other thing that's most important and has really been probably my biggest and steepest learning curve is the importance of building a team. So I don't think it was particularly clear at kind of the internship level how important the team around you were. So I just went with someone that I knew well, who had a bit of an academic background, but was mainly a clinical professional. However, as I expanded my networks, I discovered that the NIHR like to see academics with large funding having backed them, so over £200,000. And they also really emphasise Russell Group unis. So I hadn't identified those connections before starting the internship, so had to kind of quite abruptly build those networks. Whereas I think it would have been useful to know early on that it's good to have good stead with universities in advance. Tricia?
So yeah, as Grace mentioned, it's essential to build connections. I think network. I fell into research out of pure curiosity and luck. By not being afraid to ask questions, a whole new world's opened up to me. It re-energized my practice and kept me going in a very difficult job with high levels of compassion fatigue and burnout. I'd say as well, try and ignore that imposter syndrome feeling. We've had people with doctorates tell us they still feel like imposters. So have confidence and build your profile. Um, there's a lot of emphasis on getting published, so give that consideration. What could you write about? What are you interested in? Start with an opinion piece, maybe. So for a nurse, I'd say look at the Nursing Times, for instance. For you guys, perhaps the RCSLT bulletin, and take your time and set your own path. Grace, do you have anything to add to that?
Did you hear me then at all?
No.
That's fine. So the thing I wanted to talk about was the importance of allowing yourself time and research. So things don't happen overnight. Often there is a real slog in terms of application time and waiting for a response. So just managing expectations. Next slide.
So we're going to just touch on the barriers in research. There have been studies into the barriers in research, and these are some of the things that those studies picked out that really chimed with us. So lack of time, massive barrier. The internship pays for me to focus on research 1 day a week, but finding time for all this extra in a busy week. As I said before, I work in a busy environment, a crisis service, which is part of the wider acute services. Clinical need always has to take precedence, which can be hard to manage. It can also be hard for managers to see the value in research and research opportunities when their priority is clinical need. Managing your time and managing the opportunities, because sometimes the things you want to be involved in don't land neatly in your research time either. And it can be hard to switch between work mode and research mode and stay focused. Lack of management support has been an issue. You need a really good support network around you. You need flexibility from your manager. I'm really lucky that I've had this, but support from a higher management level was much more difficult to maintain because of clinical demand. It can be difficult for managers to see the value in research, again, as I said, when their main concern is clinical need. So can you bring it back to how it will benefit the team or how it will benefit the patient group to help persuade them? There's a lack of coordinated approach as well. We talked before about pathways and toolkits. A lot of this isn't clear or obvious, unlike for medics who have a clear pathway to be involved and lead research with a set time, expectations and budgets. Nurses and AHPs don't have this, and it takes a lot of effort and dedication for us to get into it. We need to look for little pots of money, like small amounts of pump priming or grants from third sector organisations to help us. So I'll move on to minority research and hand over to you, Grace.
Yeah. So both of us work with minority populations, particularly in the trans and non-binary population. People are fearful of gatekeeping, so that will be kind of withholding care if they don't engage in the service in an appropriate way, and also negative media perceptions, especially at the moment. However, co-production is essential. So, for example, I mentioned the arts and minds research that I've been doing, and that's come from the community. It's been delivered by the community with my gender outreach colleague and for the community, and the engagement has been greatly supported by that. So we've had over 20 people engage in the project, whereas when I've done research independently, I've had far less responses because it's not been as focused. The idea of following the No Research About Us Without Us initiative across all populations is really useful. So there's some great resources online about that, and just considering how you can apply that in your population. And the other thing I just wanted to mention is insider research. So I'm a member of the LGBTQIA+ community, and for me, insider research makes me feel more comfortable when I'm engaging in the process, knowing someone's part of the community. And it also, as a researcher, makes me feel empowered because I'm hopefully making people feel safer about participating in research. Although the bias does need to be mitigated with greater peer review, it is essential that research participants feel comfortable and safe in sharing their views. And as we've mentioned before, people are willing to help, they want to engage with you, so peer reviewing is possible as well. Trisha?
So it just makes me think about, when we talk about minority research, it makes me think about the stigma within mental health. So people with mental health problems are more likely to experience socioeconomic disadvantages. There are a disproportionate amount of Black people within mental health services as well, and they're more likely to be detained under the Mental Health Act. There may not seem much overlap between me and Grace and our work, but my focus is women and the disadvantages they face in society. And we live in a particularly patriarchal society, and we don't have equity with cis men. And I also just want to mention trauma-informed research. So there is a trauma-informed research charter that you can sign up to. It's quite easy to find on the internet if you Google it. And so I think I'm just going to hand back over to Grace for our take-home points.
Yep. So our main take-home point is something that me and Trisha discussed several months ago about the importance of being Weird Barbie. So I'm not sure if you've seen the film, but in the end, Weird Barbie is the reason that Barbie Land is saved. She comes up with alternative ideas and thinks outside of the box. So it's the idea of being that outsider seeking change. Don't go along with it just because that's what we've always done. It can be quite common, especially as a newly qualified therapist. I remember just going along with people's ideas because I didn't want to step on any toes. So I think remembering to kind of express your views and seek change is the most important thing. Trisha?
So I would say send the email, have the chat, talk to anyone who will listen, email everybody. Don't worry about annoying them. Grace?
The other thing is to just publish the thing. So as Trisha mentioned, Bulletin is a really good source for publication, and there's lots of different styles of write-up that you can do in there. And also just look at if you can get involved in other people's publications. So often people will benefit from support. So emailing universities to ask if there's any research currently going on that you could be involved with is another really useful thing. Trisha?
So also another kind of weird Barbie idea, write your own definition of clinical academia. Be flexible with your journey, be determined, write your own definition, do things your own way. And then I'd end with, and we'd both say this, research is for everyone, don't think it's not for you. So we just want to say thanks for listening, and here's our contact details if you have any questions.
Thank you so much.